Carolyn was named to the Royal Society of Canada in 2021. She is currently the chair of the Department of Philosophy in the Faculty of Arts and Humanities. Carolyn is one of Canada's leading experts on the ethics of adoption, conscientious objection in the provision of medical care, and the nature and role of trust in healthcare settings. Her interdisciplinary research and advocacy have had direct impact on public policy, including on a new employment insurance benefit to ensure equal treatment for adoptive parents. Carolyn's a prolific scholar with 2 single-authored books and an impressive citation rate. She's also received more than $22 million in external funding and is one of the busiest graduate supervisors in her faculty. Carolyn's distinguished service record extends beyond the walls of academia, as she is also a founding member of the Advisory Board of Ontario's Adoptive Parents Association and its first board chair. So congratulations, Karen. Please come and deliver the first lecture.
So I just want to start off and thank the people who really are responsible for me receiving this award, especially my colleague Rob Stainton, who nominated me, and Elena Paul, who is our Associate Dean Research, who really pulled the package together. I know how much time that takes to do that, so thanks to them. Thanks for colleagues who wrote in support of this, the selection committee and the provost and the president for continuing to support the DUP. So I've titled this talk Publicly Engaged Philosophy because that's a theme that runs through my research and my teaching and even my service at Western, so I'll talk about that. So what I'll do is just say a bit first about what I mean by publicly engaged philosophy, talk about how it runs through those 3 aspects of my job, and then say a bit about the people who've supported me along the way. So there's relatively recently, the past couple decades, been a movement in favor of publicly engaged philosophy, or what some call public philosophy, others call it engaged philosophy. And there have been networks set up. The Public Philosophy Network is a big one, a worldwide network. There have been centers and institutes created, like the Center for Engaged Philosophy. And this is really a movement away from thinking of philosophy as a sort of detached and solitary exercise where you sort of sit like this guy up in the corner and ponder sort of deep thoughts. I'm going to talk a bit in the next slide about how I interpret what public engaged philosophy is, but I just want to say, I want to be clear that, I don't think all philosophy should be publicly engaged, actually. I mean, I do this kind of philosophy, others do philosophy differently, and I really value the diversity within my discipline. It's part of what makes it so fascinating. So I do this kind of philosophy, but I don't think everybody should be doing it necessarily. So what is this? Here are some features that I associate with this kind of philosophy and others have associated with it. So it's problem-based. It focuses on social problems that we're facing, like climate change, like distrust, misinformation. It focuses on these problems as they're occurring in our existing societies and tries to contribute philosophical sort of insight about those problems. It is interdisciplinary, so we engage with disciplines other than philosophy in understanding these problems and in trying to come up with solutions to the problems. It's public-facing, for want of a better word. So we're communicating with the public and doing this work, not just sending them our results, but actually treating the public as a source of insight and engaging with them along the way and again, understanding the problems and figuring out how to solve them. It is very much solution-focused or policy-focused. So we don't just say, lay out what a better world would look like, a better society would look like. We think of steps to take to get to that better state. And often, we provide recommendations to people who actually have the power to implement these recommendations, and sometimes we do that with them. So we work with policy people. So lots of people do publicly engaged philosophy. What's my publicly engaged philosophy like? I mean, it's a bit hard to summarize, but I think what's distinctive about it is the problems generally concern the ethical treatment of women, and that should say, or other oppressed groups by public institutions. particularly what some people call public service institutions, and the ones that I tend to focus on are healthcare and child welfare, particularly reproductive healthcare. So just to give an example, the first book I published, Self-Trust and Reproductive Autonomy, was about the problem of patients in reproductive healthcare contexts being able to choose autonomously, trust themselves enough to choose autonomously, despite sort of oppressive forces that can inhibit them from doing that in those contexts. Another distinctive aspect of my approach, or my public engaged philosophy, is that my approach to it is feminist. And I can't go into detail about what that means, but basically I take as a starting point that our societies are marked by serious inequalities. And I use methods developed within feminist philosophy for approaching, analyzing social problems within societies like that. Okay, I can't talk about what those methods are, but interestingly, they overlap quite well with my commitment to publicly engaged philosophy. So feminist philosophers are very committed to looking to the voices, of people in the community and have them, influence the work they do. They're also committed to social change. Okay. So just to give some sample projects, particularly the ones that I would say are most deeply publicly engaged, I'm just going to talk about two. One is, it was funded by a CHR project grant called Let Conscience Be Their Guide, Conscientious Refusals in Reproductive Healthcare. Another was a project called Time to Attach, and that was funded by Western Strategic Support for Shirk Success. And there was no Shirk Success in the end. We did apply for Shirk. It was very time sensitive, but we applied for Shirk, and I think it was just so publicly engaged, this project, and it's so strange of a project for an academic to be involved in that they did fund it. So good on Western that they did. Okay, so just a bit, the Conscientious Refusals Project, just going through these features of publicly engaged philosophy. It was problem-based, focused on regulating conscientious refusals in healthcare, particularly reproductive healthcare. So a classic case of a conscientious refusal is a physician refusing to provide abortion services. So generally, these are refusals to provide legal and professionally accepted services. This project was interdisciplinary. It mainly involved people in philosophy and law, but we also engaged with people in medicine and also in theology. I left that out up there. It was public-facing. We had a number of public events, including a CIHR Café Scientifique, which those of you in CIHR will know what that is. We had that at the Covent Garden Market in London. There was a panel, and it included a Catholic priest from St. Peter's, and also an obstetrician gynecologist who was the only obstetrician gynecologist in Canada at the time providing abortions on PEI. So that was a fascinating discussion. To some extent, people were just talking past one another, but I think there was some engagement. So this is a very policy-focused project. We developed recommendations on regulating conscientious refusals. We provided submissions to the colleges of physicians and surgeons across the country on their policies, but we also met with them before developing the policies. So we had a meeting with about 7 of them from different provinces, which was fascinating. So it culminated in those recommendations. For me, it also culminated in that book, which really, I think, provides a kind of philosophical foundation for the kinds of policies we recommended. The Time to Attach, weird project. So it was problem-based. It focused on the need for more time to attach for children from care. So these are children who were in the care of the state and were put in permanent placements with families or extended biological family. And they're among the most vulnerable, for sure, children in our society. Very many are members of marginalized groups. And before we did the project, they were not able to spend as much time with their new family as a child is who's been born into their family. So they had 3 months less time because they were granted parental leave, the parents or caregivers, but not what's called maternity leave. So we wanted to argue that at the very least, the leave should be equal. And we did that on grounds of these children needing more time to attach to their new caregivers. So this was interdisciplinary. It involved people just in academia. There were people outside, philosophy and social science. And my main collaborator on that was the lovely Lorraine Davies, who's right over there, from social science. And she and I developed a survey together. I'd never developed a survey before. As a philosopher, we don't do that kind of thing. And we surveyed almost 1,000 parents and caregivers. And these results were part of this report that we wrote. So it was like a white paper report, which we wrote for nonprofit organizations in Canada who were fighting for permanency for children and better time to attach for those kids. So the report, you see an image of it up there. It provided the foundation for this advocacy work that the organizations did. And we were involved in that a little bit. We did go to Ottawa a couple times. There's an image up at the top. You can't see it very well with me. I brought one of my kids with me, and that's us with Rob Oliphant, who is a nice guy, MP Rob Oliphant. That was fun. So we didn't do a lot of the advocacy, though. We were writing the sort of report that formed the foundation of that. And it was successful, the advocacy work. So last fall, the government did change its EI benefits. So there is equal leave now for these families. Some of this work was just informed by earlier work I've done about the value of non-biological families compared to biological families, especially in that book that's in the corner there. So I am about to take an administrative leave starting in July, and I'm excited to be able to work on some new projects. One is this first one here, Institutional Distrust and Injustice, which is about the distrust of marginalized groups in public institutions, particularly healthcare and child welfare. That's funded by SSHRC. And then another about regulating medical AI, which I'm involved in with a large interdisciplinary group. And the PI there is Colleen Flood from the law school at Queen's. So just turning to my teaching, away from my research, I've said that I think it's informed by my commitment to publicly engaged philosophy. And I think that's largely true because of the kind of learning that I engage in, or my students engage in. Community engaged learning. I've taught a couple of courses in that at Western. Experiential case-based learning, teaching them about the relevance of philosophy to sort of everyday life and cases. At the very least, my teaching involves active learning, and I think that aligns well with the kind of public-facing element of publicly engaged philosophy, where you do philosophy with others who don't necessarily have PhDs in philosophy, and you appreciate the sort of insights they can bring to philosophical discussion. And I just wanted to note here that I've received a lot of support from CTL, from the WALS people, from Student Experience, in particular their Community Engaged Learning Office in setting up these courses. You'd never be able to do that without these folks. Just quickly on service, my biggest commitment so far inside the university is certainly being what I call a pandemic chair. I call myself a pandemic chair. I started being chair right before the pandemic started, and it basically affected everything I did as chair. There were some things I was able to do a bit as chair that were related to publicly engaged philosophy, and one in particular is promoting AI ethics and the teaching of it, and Arts Humanities' role in teaching that at the university. And then the biggest commitment outside was, as already mentioned, I was the first board chair of Ontario's Adoptive Parent Association. They've changed their name now to Interwoven Connections, which is just an effort to make it more inclusive, because they don't just help adoptive parents, they help kinship parents, caregivers, or what are called customary caregivers. Okay, just quickly, my people. I have lots of people who've influenced me in doing publicly engaged philosophy, has certainly enriched my professional life and supported me in my career, and these are overlapping categories here. One is my dad, who was a very publicly engaged person. He was a very successful lawyer, a Crown attorney when I was growing up, but he also spent a lot of his time with community organizations. And I think he really made it impossible for me not to be a publicly engaged philosopher. These women have had a profound influence on me. They're all academics, they're all fellows of the Royal Society. A couple of them are members, have the Order of Canada. The middle person is Susan Sherwin, who was my PhD supervisor. The bottom left is Christine Overall, my MA supervisor. These women still mentor me to this day. They're going to be mentoring me when they're 90. Françoise Baylis in the bottom corner, we've written a lot together. She was involved in the Conscientious Refusals Project, same with Jocelyn Downey. You might be familiar with some of these people because they often appear on the news. Colleen Flood up in the top left, who I'm working on AI stuff with. So, all very publicly engaged and really doing that kind of stuff before there was any movement in favor of it, and really taught me how to do it. My students, I've really been blessed to have wonderful graduate students. This is just a selection of an old crop of them. They're all doing really well. And I really feel like it's been a privilege of mine to be able to mentor students. Sometimes, it's emotionally exhausting. I was basically texting with one late last night who's just scrambling to get her thesis in the next 7 days. So it can be kind of draining, but it's also incredibly rewarding. And I've involved them. They've been involved and been instrumental in the publicly engaged work that I've done. So in terms of supporting me as chair, the most important person here is Elisa Kilburn, who's the admin coordinator in philosophy. I would not have survived, and I don't think our department would exist really without Elisa Kilburn. So to her and all the other staff who make it possible for us to do this, thank you. And I just want to, many of my colleagues have been very supportive too, in particular Helen Fielding and Corey Dyke. Corey's at the back there. They really helped to keep me sane as the department chair. And just lastly, I have a wonderful family, a wonderful spouse, and 2 lovely children who are back there hiding. And they're very patient with me. My mother, who's on the right here, my mother-in-law right beside her, they're very supportive of me too. So I just want to take the opportunity to thank them. I mean, we don't often get the opportunity in academia to thank the people who make it possible for us to do what we do. It sort of sounds like a retirement speech or something. And I'm not retiring anytime soon, although I have embraced the fact that I am now a senior academic, I guess. So thank you, everyone. Thanks. Yeah.